Hello everyone, another Q&A video today. Topics today are antimony, chelation, copper related to biofilms in the gastrointestinal tract, and then how to stay healthy when exposed to cute little grandbabies that bring germs into your household. Just before jumping into the video, if you don't mind taking a quick moment to please like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. And as per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. So the first question is about antimony. And so it says here, do you know what products are good for removing antimony from the body? I have been using zeolite, coriander, chlorella, and silica. These eliminate other metals, but do not reduce antimony. I have hair tests before and after using these mentioned products, but none of these eliminate antimony. So thank you for the question. Never had a question about antimony before, so this is very exciting. To my understanding, the best agent to remove antimony is DMPS. DMPS is a chelating agent, and typically it's used either orally or intravenously. You generally have to get it through a clinic, but to my through a healthcare provider. I can't just buy it online, to my understanding, and that is, to my knowledge, the most effective chelator for removing antimony. Now, I did want to just quickly mention, and I have a couple of videos about this, but just about using hair mineral tests or hair toxic metal tests to look for heavy metal levels. And if you're interested in a deeper dive in this, if you go to my YouTube channel, if you're not already on there watching this video, just keyword search, heavy metals or my name or hair test, or I don't know, something like that. And there's a video all about that. But the punchline from that video is I'm really not sure about the efficacy or the reliability, efficacy, kind of the meaning of a hair mineral test or a hair toxic metals test when it comes to assessing various heavy metals. To my understanding, there is some evidence that hair mineral analysis could be effective to some extent for assessing methyl mercury levels, and possibly for lead levels to some extent, but to my understanding, we really can't glean a ton of evidence about the body burden of those metals from those tests. Now, I know some clinicians out there would disagree with me, but that is my understanding from, at least, to the best of my knowledge. I'm not convinced that they are a really great indicator of our heavy metal loads in our body. So just throwing that out there. The other thing I'll throw out there is that where I have done many provoked urine heavy metal tests using DMPS and EDTA as a provoking agent to basically try to flush heavy metals out of the tissues to see what comes out through a urine test, and I don't know if I've ever seen an elevated antimony before. So while antimony is something that's fairly pervasive in our environment, due to to my understanding mostly from flame retardants, maybe from certain industries, I don't know if antimony toxicity is really much of a thing. So I just kind of throw that out there. Obviously, not giving any medical advice or anything like that, but if a patient came in to see me and they had an elevated level of their like a hair mineral or hair metal analysis showing that there's elevated antimony, and they said hey, I think this is the cause of some of my problems, or I'm stressed out about this, I'd be probably looking for other things to maybe explain why their symptoms were afoot, as opposed to that. Or at the very least, I'd run a confirmatory provoked heavy metal urine test to see are we actually seeing more can't think of a more diplomatically friendly term, but just a more maybe objective or reliable test to look for antimony levels. So again, just my thoughts on the matter, but I'll leave it there. So thank you for the question. Next question is, what are the considerations for treating gastrointestinal biofilms that occurred from elevated copper levels? Would EDTA, which is a chelating agent, be considered? Would the addition of cellulase/nattokinase/lumbokinase also potentially help to break the biofilms? So thank you for the questions. So I'm not, honestly, I'm not really 100% sure what, if to any extent copper is involved in biofilm formation. I know that heavy metals are part of what makes a phase 2 biofilm, i.e. the most tenacious type of biofilm so tenacious. It is the metal content, which is why heavy metal chelators seem to be so important for helping to get rid of those phase 2 biofilms. I'm not really sure to what extent copper is involved. Any of the lectures that I've heard on this topic, I haven't specifically got into the copper levels that are involved there. I was under the presumption it was more like mercury and lead, which are quite a bit more pervasive, but it could very well be that copper is a big thing, and I just haven't heard about it. So if anybody listening to this, could send a citation for, like, yes, there's elevated copper and biofilms. I'd be curious to take a look at that, but it's not something that's come across my radar so far. If there is elevated copper, then EDTA does bind copper. To my understanding, it's not the best agent to remove copper. There's another agent, I believe the acronym for it is DPTA, but that's another chelator, but EDTA does bind copper, and generally when it comes to intestinal biofilms, I would, my practice, I would definitely be, we regularly use either EDTA or DMSA as a rule, DMPS as well, but we would definitely be using those types of chelators. But yeah, if I had some evidence that copper was a culprit, then EDTA would be higher on the list than DMSA or DMPS in that case. And then in terms of adding in cellulase or nattokinase or lumbrikinase, again, if you go to my YouTube channel, if you're not already there, keyword search biofilms in my name. I have several videos about biofilms. There's probably one called something like the best agents to break down biofilms or something like that, and then I get into a little bit more of the weeds of phase 1 versus phase 2 biofilms, and how lumbrikinase and nattokinase, like these proteolytic enzymes, they're good phase 1 biofilm disruptors to my understanding, but don't really do much against those more tenacious phase 2 biofilms, and so I don't really use those in practice as a rule to break down biofilms when we're wanting to hit it with the strongest tools that we have at our disposal. So the last question here was, I visited my 2 youngest grandbabies for 10 days, and besides being very happy to have spent quality time with them, I also brought back the flu and an ear infection. I'm assuming they brought the germs for both of these home from daycare, although this is getting better with golden seal tincture, slippery elm, mullein/garlic oil, etc. I was wondering what your opinion is on the best way to stay well. I usually do, other than very bothersome menopausal symptoms. These on top of those is not nice, I can imagine. How do we make sure any opportunistic bugs don't find our body a very habitable place? So great question. So for patients who are generally, in my practice, for my patients who are generally healthy, if they're getting a cold or flu, maybe once or twice a year, they fight it off pretty easily. They're not sick for more than a day or two, maybe 3 or 4 at most. That's probably par for the course living in our world. That's debatable, but I'd say that's probably not something where we really have to be worried about their immune system integrity. If a patient's getting sick more frequently than that, if they're sick for longer than that, it takes a longer time to shake off the cold or whatnot. If it goes into their lungs really easily and becomes a bronchitis or something more, pneumonia or something, those are cases where I'm going to be thinking about using using bovine colostrum is a favorite of mine. So that's something that I've seen good results with boosting immune system function. Also, there's this formula by this company called St. Francis Herb Farm called Deep Immune. It's a combination of different herbs and mushrooms like reishi and astragalus root and cordyceps and things like that seems to help to boost the immune system integrity. So if we kind of need to boost the immune system, those are things that I'll oftentimes fall back on. But what I'm a really, really big fan of is using preventative nasal sprays and throat sprays. My favorite is this product called ACS 200 by this company called Results RNA. I have no financial affiliation with any of these companies. And basically spraying the back of my throat, spraying up my nose. If I know I'm going to be around germs or if I'm around someone who's sick, doing that around that time, maybe for a couple of days afterwards, I find can be very, very effective at just kind of fumigating the area so it's harder for the viruses to take hold. So that's really kind of my go-to. It's what I've been relying on for years. There's other sprays and things that can be used as well, like iodine nasal sprays or throat sprays or essential oil sprays, but I really like the silver because it's user-friendly, and I find it just works really, really well against viruses. So thank you for the questions. If you have any questions, post in the comment section below. I'll do my best to answer as soon as I can.